So we're a social care organisation. We have a number of supported living services in Hertfordshire as well as a community outreach team.
We support people with a mental health diagnosis, people with an autism diagnosis, sometimes both. The ultimate aim of the service is to help people to become more independent.
We really are here to kind of make a difference to people's lives, and yes, of course we are a for-profit organisation, but that is very much at the forefront of what we do.
Before we used Access, we used the old traditional pen and paper method. And when you've got 7 residents living in a home, that is a lot of handwriting that you've got to do.
A lot of people in social care complain that they spend too much time having to write stuff and duplicate information often.
It was quite laborious, but also it affects the amount of time you can actually spend supporting people.
The evidencing that you're doing is kind of counterproductive, and you don't want that.
Being able now to just have everything online and accessible to everyone is so much easier.
We use it for pretty much everything. We also use it for our staff files.
With Access, you can adapt all the documentation to best suit yourself.
The report function for me is probably the most useful thing. It saves time when I'm doing audits.
Almost from week 1 you could see the difference in terms of how much time people were spending on the actual important stuff, the face-to-face support.
I've seen confidence blossom in some of our residents.
I think they really enjoyed the idea of staff coming in with a tablet and sitting down next to you and doing stuff with you that would otherwise be done behind a locked door in an office.
We want the service to be as co-produced as possible, so they can review things, anything they disagree with, anything they want to take charge of they can, and they can edit and they can get involved.
So only 2% of social care services across the country get an outstanding rating from CQC.
And you just kind of expect to get good, then you kind of get a outstanding, everyone's like, oh, okay, that's quite nice.
It's definitely something that would have been very difficult to achieve without any Access software in place, in terms of it being quite a bespoke piece of software that we use.
I would highly recommend using Access.
There's no excuse to be using quite archaic methods of evidencing. It's obviously going to be an enormous stress release for you day to day, and I can only see positives from using the software.